Colorectal cancer is the second deadliest type of cancer in the world, and 90% of the time it can be cured, as long as it's diagnosed in the early stages. And besides the signs and symptoms, I'm also going to tell you a way to prevent this type of cancer. That's right, not just early diagnosis by recognizing the signs and symptoms. I'll also talk to you about tests, but more importantly, ways to prevent it. There's a way to greatly reduce your risk of developing this type of intestinal cancer, called colorectal cancer. Do you want to know all these tips? So let's get into the video. I'm going to start with the signs and symptoms, then I'll talk about habits, and after that, how to prevent it. And the three big mistakes when it comes to colorectal cancer that increase the risk of death. The first sign of this type of cancer, colorectal cancer, is weight loss. Unexplained weight loss. Why do I say unexplained? Because a lot of times you started a diet, you started working out, for example, and it's normal for you to lose some weight, especially if you're dieting to lose weight, for instance. But this warning sign here is weight loss without any cause. What is the value we consider? A major warning sign? 10% of your body weight in 6 months or less. That's a sign that needs to be investigated if you might have this type of cancer. Of course, there are other diseases that can also cause weight loss, like diabetes. In the more advanced stage of type 2 diabetes, or even the early stage of type 1 diabetes, can cause weight loss due to changes in insulin. Hyperthyroidism, when the thyroid produces too many hormones, can also cause weight loss. So you have to evaluate the causes of weight loss. But colorectal cancer is one of those causes. And why does this happen? One of the reasons is that cancer can produce substances that make you feel more nauseous, more fatigued, with a reduced appetite, which can also be one of the signs. And cancer, as it grows, can also consume nutrients, causing you to lose weight. There are other factors as well, but these two are very important. The second warning sign is a change in bowel habits. Why did I say change? Change? People usually think it's just constipation. The person gets more blocked up. They used to go to the bathroom every day. Now you go to have a bowel movement every 3 days, every 4 days, for example. This can be a sign, but the other extreme, diarrhea, also requires investigation. So it's a change in pattern. If you used to go to the bathroom every 2 days and now you're going every 5, or now you're going 2 or 3 times a day, that's a warning sign. Remember that it can also happen that you alternate between periods of diarrhea and periods of constipation. This can also mean that something is wrong with your intestines and is one of the reported signs of colorectal cancer. And the third warning sign is bleeding, blood in the stool. And here it can show up in 2 ways. The first way is bright red blood, which usually causes more fear. Many people end up worrying more when they have this type of bleeding because you can actually see the blood. When the tumor is closer to the end of the intestine, it can cause this type of bleeding, which is bright red blood in the stool. The second type of bleeding, and this one is more dangerous because many people end up not seeking help, is digested blood, called malignant, which is blood in the stool, but you can't actually see the blood, and you'll notice it by the darkening of the stool. It's also a warning sign, a change in color. Darker stools, because if the tumor is located and bleeding in a more distant part, farther from the end of the intestine, the blood can be digested and cause a change, a darkening of the stool. Remember that both bright red blood in the stool and darkening can be caused by other things. For example, bright red blood is most often caused by hemorrhoids. Hemorrhoids can also bleed and show this sign of bright red blood. A change in stool color, for example, could be something from your diet, like eating beets or dragon fruit. Do you like eating dragon fruit? That can also change the color of your stool. But it's a warning sign, and yes, you should seek help. Even though the most likely cause is bleeding from hemorrhoids, you still need to check if there's something wrong with your intestines, like some type of cancer. Colorectal. A lot of people ask which type is most common. The most common type is colon adenocarcinoma. And sign number 4, a palpable abdominal mass. And here we're talking about a more advanced stage. But before that abdominal mass can be felt, it might cause bloating, that feeling of fullness. You eat a well, but it feels like you ate a lot. So you also need to investigate to rule out colorectal cancer. I mentioned the intestinal mass here. Many times, the doctor can feel it when examining the abdomen. And then, yes, that's a sign the cancer is already at a more advanced stage. But before that, it can cause this bloating symptom, changes in appetite. Because of this, because of the obstruction in the sign, number 5 is tiredness, that fatigue. You wake up already feeling tired. Why? Because besides the cancer-producing substances that can make you feel more worn out, as you saw, it can also cause bleeding. And this bleeding can cause anemia, especially iron deficiency anemia. You end up losing iron through this bleeding. This can affect your blood, causing a reduction in red blood cells, in erythrocytes. And this anemia can have a range of signs and symptoms, like tiredness and reduced physical fitness. Before, you could climb a flight of stairs. Now you go up one flight and you're already tired. Or maybe you used to climb 4 flights of stairs, but now you go up just one and you're already worn out. Paleness. So, cancer. Extreme fatigue, for these reasons I mentioned, also needs to be investigated. Of course, tiredness is a very common symptom. Many diseases show up this way. But since colorectal cancer is also very common, you have to consider ruling out this possibility to get a diagnosis as early as possible. And sign number 6 is tenesmus. What is that? You go to the bathroom to have a bowel movement. You go, and then you feel like there's still something left. You can't get that feeling that you really managed to empty your bowels completely. You always have that urge, even after having a bowel movement. This can happen because the tumor mass can send signals to our brain, letting you know that you still need to go to the bathroom. Changes in the shape of your stool can also happen, and I'll include that in sign number 6. Like thinner stools due to narrowing, called ribbon-like stools, which can also be a sign. And sign number 7, which is also a warning sign for colorectal cancer, is abdominal pain. And this pain in the belly, it can be like a cramping pain. That's what patients usually say. But any discomfort or pain, not necessarily cramping, also requires a more detailed investigation. And now, how can you avoid it? What are the tests? How can you prevent it? What's the best way? And what are the main mistakes? And now I'm going to share 4 tips to help you reduce your risk of colorectal cancer. The first tip is to eat fruits and vegetables because of the antioxidants that can fight free radicals and also because of the fiber. The second tip is to cut down on processed meats and cold cuts like salami, parma ham, turkey breast, which a lot of people think is healthy, mini salami, and kappa. It's best to cut out these cold cuts completely because they contain nitrates and nitrites that increase the risk of colorectal cancer. I know that many people will say, oh, but I ate ham once, I ate salami, and I don't have colorectal cancer. Well, here's the thing. I'm saying it increases the risk. It's a risk factor, not a guarantee that everyone who eats cold cuts will get cancer. And what amount of consumption increases this risk? 3 or more times a week, okay? So processed and cured meats consumed 3 or more times a week also increase this risk. That's another thing a lot of people say to defend eating these kinds of processed meats with preservatives. Oh, but if you eat it just once a week, it doesn't increase the risk. It's true. Studies show that the risk really starts to go up at 3 or more times a week. And the third way to reduce the risk of colorectal cancer is through physical activity. 150 minutes or more per week. It can improve body composition, boost your metabolism, and decrease fatty tissue, the adipose tissue. We know that fatty tissue is active. It produces substances and has a metabolic function, increasing inflammatory markers. We are increasingly studying these inflammatory markers, these metabolic changes, and the increased risk of cancer. This has already been proven. Did you know that obese people have a higher chance of developing colon cancer? So, physical activity improves metabolism and also helps protect you. And the fourth way to reduce it, and this one can actually lower a significant portion of cases, is fiber consumption. What would be the recommended fiber intake? Between 25 and 30 grams of fiber per day. If you follow tip number one, which is eating fruits and vegetables, and now this one, adding chia seeds, flax seeds, pumpkin seeds, sunflower seeds, you get even more protection because it improves your bowel movements and reduces the contact of certain harmful agents with the lining of your intestine. This is also proven. Consuming fiber can help. These are the ways to reduce the risk, but I said I would share a tip to actually prevent cancer. Look how interesting, not just early diagnosis, but also a way to prevent it. And that's through an exam called a colonoscopy. The current recommendation is to start screening for colon cancer with a colonoscopy at age 45. In some countries, that age hasn't changed yet. It's still 50 years old. But in several countries, that age has already been lowered to 45, which is the current recommendation. The trend is to keep it at that age because studies have shown there's a benefit if screening starts earlier at 45. And why is this exam so important? Because during a colonoscopy, you can remove polyps before they turn into cancer. Most intestinal cancers, colorectal cancers, develop from a polyp that starts to proliferate. There's uncontrolled growth, and it eventually becomes cancer. And then as it grows, it starts causing those symptoms. And during a colonoscopy, the doctor can spot these polyps and remove them. Look, isn't that interesting? So even before you have a problem with a colonoscopy, you can solve it. This exam is really fascinating. And the colonoscopy is also very important for early diagnosis. You saw that in 90% or more of cases, it can be curable. So with a colonoscopy, you can get this diagnosis before you even start to have a palpable mass, for example. And then, yes, the chances of a cure are much higher. So what are the three mistakes I'm seeing that increasingly raise the risk of death? Well, the first mistake is replacing the colonoscopy with a fecal occult blood test. Why? Because many times the tumor might not bleed, or when you take the test, the tumor isn't bleeding and the result comes back negative. And you'll be left with the false impression that everything is fine, when in reality you have cancer and the test came back negative. So the best test is the colonoscopy. There is no other type of test, not even the sigmoidoscopy, and much less so. The fecal occult blood test cannot replace the colonoscopy, so don't make this mistake. There are many people who don't want to do a colonoscopy because of the preparation or because they're afraid of the procedure. And they even end up asking me for it. Many times during a consultation, they say, I want to do the fecal occult blood test. Or when I mention colonoscopy, they say, oh no, everything's fine because I already did the fecal occult blood test. This is a big mistake and can delay the diagnosis. And the second mistake is being afraid of a colonoscopy, being afraid of some complication like a perforation. Does this risk exist? Yes, this risk does exist, but it's much lower than the risk of getting cancer. It's much more likely that you'll develop cancer, given how often it happens, than that you'll have a problem with a colonoscopy. So is it worth getting a coloscopy? It doesn't make sense. You're trading it for a risk that's much, much greater. Okay? Nowadays, with the techniques and specialized doctors, it's very hard to have this kind of complication. It does exist, I can't lie about that. But that doesn't justify not getting the exam that could save your life and even prevent a type of cancer just because of this fear. And the third mistake, and this one is also very common, is getting a tumor marker test for colon cancer called CEA, carcinoembryonic antigen. This test is not for screening. It's not used for that. It can be misleading. It can give false results. Just like the fecal occult blood test, this tumor marker that's gotten really popular lately. A lot of patients mention it to me, like, oh, I want to know if I have cancer through that blood test that detects cancer. Well, this test isn't for that. Why not? Because there are many types of cancer that don't produce carcinoembryonic antigen, the CEA, so it can come back negative. And there are also other diseases that aren't cancer which can raise CEA, the carcinoembryonic antigen, and cause a lot of confusion. So why does this test exist? You might be asking if it's good for anything at all. No, this test, it's used to monitor patients who have already had cancer, who already have a diagnosis, and have already had surgery or treatment, for example. In that case, yes, it's useful for follow-up, but not for screening or diagnosis. Did you like this video? On a scale from 0 to 10, what score would you give it? If it's a 10, I'll make more videos like this one. I know this topic brings up a lot of questions. Write yours here. I always enjoy reading them. And also tell me which part of the world you're watching this video from. I'm speaking from Porter Leyte. Now, I'm going to leave a suggestion for you to watch. It's a video where I talked about cholesterol. Did you know there are foods that can lower cholesterol and reduce cardiovascular risk? And there are foods that can increase that risk by raising bad cholesterol. In this video right here, I talk about the best and worst foods for cholesterol.